What's the biggest risk to your retirement? It's not the stock market. It's not inflation. It's needing care and not being prepared for it. Long-term care. It's not fun to think about, but nearly 70% of retirees over 65 will need it. And no, Medicare does not cover most of it. Let's talk numbers. A semi-private room in a nursing home? Over $9,500 a month. That's more than $114,000 a year. And that's just for one person. One health event, one fall, one diagnosis, and your retirement savings could be toast. That's where long-term care insurance, or LTCI, comes in. It's designed to help cover the cost of care when you can't do basic things on your own, like bathing, dressing, or eating. And it's not just for nursing homes. It can help with assisted living, adult daycare, even home health aides. But here's the kicker. You can't wait until you need it. If you already have health issues, you might not even qualify. That's why the best time to look into LTCI is when you're healthy and think you don't need it. So who should consider it? You're in your 50s or early 60s, you want to protect your retirement savings, and you don't want to rely on your kids or Medicaid. Every policy is different. Some cover just nursing homes. Others include in-home care and more. You've got to read the fine print. What triggers benefits, what's excluded, how long it lasts. Look, long-term care insurance isn't for everyone, but for many, it's the difference between staying in control or watching your retirement unravel. Want to know if it's right for you? Join us at an ARI workshop. We'll walk you through the options, the costs, and how to make the smartest decision for your future. And if this video gave you something to think about, hit that like button, subscribe for more retirement insights, and share it with someone who needs to hear this.